I think we'll go ahead and we'll try to get started back. We're trying to catch up, make up a little bit of time here. We'll begin with another program on heart disease or cardiovascular disease. And we'll try to move fairly quickly through this. We appreciate your endurance. We know it's not easy on Sabbath afternoon to sit in a place and just listen. It's a lot easier for us up here talking than it is for you sitting. But we'll try to get this information out quickly because we have one more presentation. So we refer to this as cardiovascular, those things that affect the heart and the blood vessels, all right? And you can see that we still say, some of us, that heart disease is the #1 killer of individuals in this country. I've doubted that for many years, but it's what the world still says. And second is cancer, right neck and neck, about 1 out of 4 people with each of those diseases. But how many of you have ever heard of a wonderful gentleman? He's a cardiologist. He practices down close to Wildwood in Cleveland, Tennessee, named by the name of James Markham. Have you ever seen him on 3ABN? Yeah. And Jim and I, we go back a few years, but it's really nice. He has written, I think it came out in 2013, a book. He's wrote 2 of them. They came out about the same time, but one was called Medicines That Kill. I don't know if any of y'all have read that. But I've known all these statistics starting in the late 1990s, coming out of the Journal of American Medical Association, and I've kept track of this all the way up, 2000, and early 2000s, 2006, 2007, 2013, and so forth and on. And I was tracking. Now, these are not statistics that have been compiled by other than either public health agencies or medical agencies like the American Medical Association, Institute of Medicine, those things. So they're not coming from these peripheral either individuals that are just shooting at the medical profession, and I think that's very unfortunate. But this is actually coming from the medical profession itself and from public health agencies like the Center for Disease Control, Institutes of Medicine, and so forth. And Jim, who is a cardiologist, he compiled now, I knew up until, well, I guess it was about the 2011 or so was the last that I stopped that. But Jim has compiled statistics up to the time of his book, and he says, no, cardiovascular disease is not the #1 killer of Americans. And he gives us what statistics tell us. What is the #1 killer of Americans in this country? Do you know what it is? And you won't find it on death certificates. Yeah, it's called Medicines That Kill. That's the name of his book. Drug medications. And we say that, oh, well, we know from older literature that, drugs, what is it? That multitudes of physicians and multitudes of drugs have cursed the inhabitants of this world and have sent more to untimely graves than any other cause combined. No, than all other causes combined. I know that. But, things change, right? That was back then. That's not what the Lord wants us to understand now. I would suggest that you, if you have some of these, well, they don't even call them the red books anymore, but if you want to read an interesting statement in some of the books that we feel like are from inspired sources, you might want to pick up First Selected Messages, page 41. And there you're going to find some interesting information about how the truths that were revealed to us in the earlier parts of our message are safe counsel to follow all the way unto the closing days. And it's really nice because now the medical profession itself, I remember getting alerts, and you still get them from all these drug manufacturers. Here's another alert about what these medications do. And as a physician, I don't see people as I used to that may be on 1 or 2 medicines. You know, that was okay. But I mean, now almost everybody that walks into your office is on 5 or 6 drugs. Okay? There's a medicine for cholesterol. There's 2 or 3 or 4 medications sometimes given for hypertension. And they're just added. And we get all of these, and if you'll look up just one of those and you see all the potential side effects, you'd probably think, oh, I don't know if I really want to use this, okay? Now, it's not that we don't ever use a drug. I'm not saying that, and neither does the Lord. If we have an acute situation where we need to use a medication, we will use it with the wisdom that God gives us, hopefully being able to get that person off as soon as we can, get them stabilized. But it's not just like, here is your medication, and you stay on it for the rest of your life, and this is going to take care of things. Because we can really cause people, and that's what Dr. Markham was saying. It's not heart disease that's the #1 killer. It's all these drugs that we have people on. But you'll never see that on death certificates. Cause of death, drugs. It's not going to be there. There are other problems that drugs cause, and those are what are listed. Kidney failure, whatever else it is. But we need to be aware of this because this is a big problem now in the United States, is all we call it polypharmacy. Whatever you got, I got a pill for it. And we just add it to your list. And pretty soon that list gets longer and longer. So we have to be careful and ask for God's wisdom when we need to use a medication. And we may need to do that, but try to be very, very temperate with our use of these. Physicians are encouraged now. Be careful what you're doing with all these medicines because we're really causing a lot of harm. So the #1 killer is not heart disease, but that's what the world has said. So I'm just leaving it there for your consideration. And here is a slide that shows a percentage of cardiovascular deaths from different countries. And you can see down there that if we're looking at, let's say, the U.S. along with Europe, Australia, and these, we have a fairly high incidence, up to about 50 to 62% of our population succumbing to one of these cardiovascular events. Here is from, let me get the slide up, you can maybe read it. It's kind of, the Haynes study, okay, from 2007 and 2010s, the percentage of cardiovascular disease in our adult population over 20 years by age and sex. And you can see that earlier on, it looks like the men are having the prevalence, but as we get a little bit older, even the ladies now are starting to come up, and in some of these statistics show a little bit more prevalence even than men as far as the heart disease question goes. And so while we used to say that cardiovascular disease was primarily a disease of men, we can't say that anymore. We're seeing a lot of ladies now afflicted with the same illness. And it's unfortunate, but I guess as we have transitioned and put more of things on ladies, that they're burdened themselves with these same stress issues. This is a percentage of deaths from different types of heart disease, and you can see that the major risk there, almost half the pie there, is from your coronary artery disease and hypertension. When we talk about cardiovascular problems, we're talking about strokes, heart attacks, hypertension, these kinds of diseases. And this is where God wants us to understand that we can do something. We should be doing something in the public health arena to help men and women understand why. Why is this such a problem here in this country, and what can we do? High blood pressure is the leading cause of cardiovascular disease and deaths globally. It is the major risk factor for cardiovascular disease, hypertension. And you remember the diabetic, about 3/4 of those people will all be hypertensive because of some of the changes that are occurring in the kidneys as well as in the vessels. So since we talked about coronary artery disease, what is it? It's basically, you've heard of hardening of the arteries. Basically, it's an inflammatory condition. We didn't know that at first. We thought it was just cholesterol deposits that were depositing in the walls of these blood vessels and making them stiff. Now we understand that coronary artery disease, just like so many, even cancers, start out as an inflammatory disease. And there is injury to the lining of those blood vessels, the endothelium, causing disruption of that intact membrane, and then the cholesterol that is in the foods that people are eating and animal products can transfer across that damaged lining and can deposit in the muscular layer of that vessel, the media, and then you get the coronary artery disease. Well, what's causing the inflammation? Why are the coronary arteries becoming inflamed? And if you just want to, and I'll give you a little homework assignment if you want, is go on your search tools for the internet now and just type in pro-inflammatory diets or pro-inflammatory causes. And you're going to see listed there some things that we were told years ago was inflammatory. Flesh foods, alcohol, tobacco, all of these things, they're there. Sugar in excess. We were given advance notice of this almost, now, maybe almost 2 centuries. Am I correct in that? A long time ago. 1 century, 1.5, whatever, a long time ago. And so you can see that medical science is catching up now to the wisdom that God gave to us as a people. And it should make us feel like we're the most privileged people. God cares about us. And He was trying to protect us from all of these things that now, and I'm thankful science is catching up, but just think of all the people that have lost their lives that could have been saved had they just known. And you remember the saddest statement to me, one of the saddest statements in the Bible, is my people are being destroyed because of a lack of knowledge. And God wants us to know these things. And so science is now revealing it, but we could have known. You remember how many years ago it was in this country that we first learned about the carcinogenic effect of tobacco? I can remember because I was living during that age. It was in the early 60s. In this country that we started to question, now is this really going to be, a problem here? And then they would question the tobacco industry. Oh, don't worry about that. We don't have any real evidence for that yet. But back so many years ago, we were told that tobacco was a slow, insidious, malignant poison. And boy, we can really attest to that. Tobacco now is one of the greatest now risk factors for the production of cancer, not just in the lungs, but in so many different organ systems of the body. And I think of all the wealth of information that God has deposited into this church. We are the most blessed people in the world. And now we want to become familiar with that, and then very gently to be able to enlighten a world that is in darkness, right? So that we can help them not to go there. We don't want these precious people to lose their lives because they don't know. We want to tell them. unfortunately, you're not nice. You're telling people things, and it's going to hurt their feelings. Well, we don't want to hurt anybody's feelings, but we also want to protect them, right? And so in the most loving way that we can, it's not, why are you doing that? No, it's, have you heard about this? This might be something you want to consider. We don't want to see you hurt. And I remember several people where we travel a lot, and I remember we were in a motel, whatever, and there were these two young guys, and they were sitting out there in the front, and they were just smoking. Boy, they were just really puffing away, and they were talking, having a good time. And I thought, wow, Lord, I wonder if they know. Well, I'm gonna do something. He was just urging me to do something. So I walked up to these two guys, nice fellas, and I said, excuse me. I said, may I interrupt for just a minute or two? And sure, that's no problem. And I said, well, you know, I don't really want to dabble in anybody's private concerns and business, but I am a physician, and I've been a physician for years, and I've just seen what this tobacco is doing to the health of individuals. And I said, I just wanted to just gently remind you, please, maybe you want to pray about this and just ask the Lord if this is really something that he wouldn't like you to stop, and then he'll help you. And they looked at each other, and they looked at me, but they were so friendly, and they said, yeah, that's right. You know, we've been talking about this. Maybe we ought to get off this stuff. And so that was an opening then, you know. And so I had a couple of little Radiant Living, so I got it and I gave it to them, and they were so thankful. But, you know, if we can do it in the right way and not make people feel like we're condemning them because they're doing it, but trying to help them, I think people will be open, okay? Or many will, not everybody, but they will be happy to listen to us. But anyway, these things result in a hardening or thickening of the arteries as fats are being deposited into the walls of those vessels. And as they deposit there, then the bodies in the bloodstream, there are these little platelets that are there to keep you from hemorrhaging. Like if you cut yourself, those platelets will go there and aggregate and form a clot. Well, when they see that integrity of the endothelial lining interfered with, they're going to go to that area where that fat is deposited, and they're going to clot. And when they, not clot, aggregate, and when they aggregate there to make a plug, they release certain clotting factors that then the blood begins to clot on top of that, and all of this is for the body's protection. God put it there. But when that happens, you just get a building up of more and more layers that is obstructing the blood flow through that artery. And that's what we call coronary artery disease, or atherosclerosis. Okay? That's a quick rundown on pathophysiology of cardiovascular events. Okay? The plaque can totally block the flow of blood and lead to the formation of a blood clot, which is called a thrombus, or part of that can break off and then travel on down to a smaller part of the vessel where it lodges there, and that's called an embolus. You may have heard the term thromboembolic disease. And either way, you're obstructing the flow to the brain, if it's in the brain artery, at carotids, or if it's in the heart arteries, and so forth. And the clinical picture can be ischemic chest pain. We call that angina, or angina, some people say. Angina pectoris. Pectoris means it's in the chest. And usually it's kind of it's an uncomfortable feeling. Some people, they don't describe it as pain. It's just, I don't feel so good. It feels like there's tightness or restriction. Some people say it feels like there's a balloon being blown up in my chest. And it usually comes on with exertion or after meals. And you stop, and it goes away. And then you get up and you start doing something else. It may come back or it may not. They call it walk-through angina. You may be out walking, you get this and you stop, or maybe you don't stop. Maybe you just keep walking and it goes away. We had one lady, a friend of ours, that we met at one of these Health Emphasis weekends, and she was just asking, she says, Doc, she says, I got a problem. I walk down to my garden and I get this tightness in my neck. And then I stop and it goes away. But if I start and I go back to the house and I'm walking up the hill, I get it again. And that didn't sound really good. And I asked her to please check with a cardiologist about this because she might have some problems there. And then she alerted me a little bit later. She says they have checked me out, and now I have to have triple vessel bypass, okay, for my heart, because that's what she had. She was having angina. You can get arrhythmias. You can actually get a heart attack, which we call an infarction, congestive heart failure, or sudden death from these arrhythmias like ventricular tachycardia, ventricular fibrillation, which is a real rapid, beating of the heart. And unless you cardiovert those people electrically, then they can die right there on the scene. So this is just a picture of this plaque buildup. You see on your right-hand side that plaque that's building up and starting to occlude the vessel. Who's at risk? Remember we talked about 1 in 4 individuals usually, okay, are mentioned. In fact, even in the Korean War, where they were doing autopsies on men, that were in their 20s, they already had evidence of atherosclerosis. It wasn't to the degree that it was causing necessarily, severe ischemic disease, but it was already developing at that age in the autopsies of these men. The traditional risk factors for coronary disease: heredity, a strong family history. A lot of people say, well, does that mean I'm locked into it? And I forget the epidemiologist that was at Loma Linda. I forget his name now. Y'all may have heard. But I thought he termed a nice remembrance here when he said genetics loads the gun, but lifestyle pulls the trigger. And we now have a whole new science called epigenetics that shows how lifestyle can affect either the expression or the suppression of genetic factors, which is kind of nice, which means you don't have to have the same disease that your parents did, even though that proclivity may be passed on to you. And I like that statement that the Lord has said that God's grace is sufficient to help us to overcome every inherited as well as cultivated tendency to evil. So we're not going to lose when we're working with the Lord in this matter. We just need to make right choices, and then the Lord will take over from there. But the big 3 factors, traditionally, we talked about genetics, and then smoking, high blood pressure, and your cholesterol levels. And remember, cholesterol outside of the body that is taken into the body only comes from your animal sources. There's no cholesterol in any of your plant foods. So you're going to make all you need from the liver. The liver's producing this, and we don't need extra cholesterol. And the cholesterol that is produced that comes from the dietary is oxidized cholesterol, which is much more atherogenic than what the body makes. In other words, it's what the body makes. It's not foreign. Okay. And here was just you can see the level of cholesterol levels in heart disease, and it's just a straight rise. The higher the cholesterol levels, the greater the incidence of cardiovascular deaths. And you can see where U.S. is. It looks like it's kind of in the middle there somewhere, if you can see it. And then you go to, the countries like up in Finland where they have a very high intake of cholesterol. This was a study in Finland. They took 30,000 men and women, and they had them on plans to help them to stop smoking, to lower high blood pressure, and to decrease their cholesterol intake. And the result of that study was that there was a 55% decrease in coronary disease in those men and a 70% decrease in women, which was kind of nice. So how do we reduce cholesterol? Simply, we try to stay away from those foods that are high cholesterol containing. One of the highest dietary source is your eggs, and now we understand, Harvard just came out in 2013 showing that the risk for men who consumed eggs on a daily basis versus those that maybe ate like a few eggs a year or something like that, it was really a difference, it was on a regular basis versus very few, that the risk for lethal prostate cancer was increased by 80%. for those who were taking dietary eggs. And you remember that there was nothing wrong with eggs and dairy. Right? That wasn't the problem. What was the problem? In the early 1900s, we were warned, though, that because of the disease in the animals that was increasing in proportion to sin in mankind, that we would even have to move away from these products for safety, not because they were harmful. They constituted a good food group for God's people for many years. But the diseases that are coming to us now because of the animal infestation, you can find these. They're on CDC's websites, and they're called zoonoses. Zoonoses, animal diseases that are coming to us from the animals. And you might want to explore that if you're interested in that. But again, medical science and true science is showing this. When I was at CDC, we were investigating the clustering of leukemia and lymphoma cases in the northeastern part of the United States, where there was a high consumption of dairy in that area. It was reported in the medical literature. And we went up there, and that could be the case, but we really didn't have all that together like was shown us, why we would need to just give it up, And so this is another protection that God wants us to consider, because of not only cancer, but infectious diseases and so forth, and coronary disease. Remember the three things we're warned against: combinations of food that have eggs, milk, and what was the third one? Sugar. Okay? The most atherogenic combination of foods. And those would be like in some of your, like ice cream, it has those. What are some of the other puddings and things? I forget what. Pancake mixes, where you get all of those things. So the high cholesterol and no cholesterol foods, basically just animal versus plant-based. Now let's go beyond the traditional risk factors and beyond cholesterol. Here are a few more traditional risk factors: obesity, sedentary lifestyle, diabetes, stress, and an older age population that we put as risk factors for cardiovascular diseases. And then emerging risk factors that have not, in fact, aren't even really recognized by a lot of the medical practitioners, but the small type of LDL, that's low density lipoprotein, then even higher, real high levels of HDL cholesterol, which is normally your good cholesterol. Homocysteine levels, that's an amino acid. When it's high, it can create an inflammatory response in those vessels. Lipoprotein A, fibrinogen, which is one of the things that the body uses to help clot. Ferritin levels, which is a tissue measurement of iron storage. C-reactive protein, which is an inflammatory marker. Fasting insulin levels, calcium scores in the blood vessels. This is a way we may detect early coronary artery disease if we do a CT of that area of the chest and we see all this calcification in the coronary arteries. That's a risk that we know that there is coronary artery disease. The greater the number, the greater the risk for subsequent cardiovascular events. And some say gum disease. Believe that. Now I want to just show you something I thought that was really interesting. We talked about in the last several years a radical shift has swept through cardiology, and that it is the inflammation of the inner lining, the endothelium of the heart arteries, that is one of the most important factors contributing to the formation of plaque and arterial disease. And what could cause that? I think we've talked about it. There's a statement, this is from, you'll find it in Councils on Diets and Foods: cancers, tumors, and all inflammatory conditions, diseases are largely caused by meat eating. Not totally, but largely. And that was given to us in 1896. Now this is I find this very interesting. I love to find these articles that just prove, beyond a shadow of a doubt, that God knew what he was saying. The typical diet, this is from the Journal of Manipulative Physiological Therapy. This was from 2002. The typical American diet is deficient in fruits and vegetables and contains excessive amounts of meat, refined grain products, and dessert foods. And such a diet can have numerous adverse biochemical effects, all of which create a pro-inflammatory state and dispose the body to degenerative diseases. Through different mechanisms, each nutritional alteration can promote inflammation and disease. It appears that an inadequate intake of fruits and vegetables can result in a suboptimal intake of antioxidants and phytochemicals and an imbalanced intake of essential fatty acids. Through different mechanisms, each nutritional alteration can promote inflammation and disease. Isn't that interesting? I marvel at what God is now revealing to us through the medical sciences that he revealed to us through revelation many years ago. And as an unrecognized contributor to heart disease, liquor drinkers, tobacco users may and do transmit their insatiable cravings and their inflamed blood and irritable nerves to their children. There's a genetics. But you'll see that both tobacco and alcohol can create an inflammatory state in the body, in the arteries. And that's what we're now showing. In fact, alcohol is one of the big risk factors for inflammation in most of these websites that talk about causes for inflammation in the body. We know that it inflames the stomach, causes all kinds of problems there with gastritis, ulceration. It can cause inflammatory hepatitis because of its effect on the liver. It injures the peripheral nerves. It injures the brain cells. I mean, it is truly a poisonous agent. And as a rule, every intemperate man who rears children transmits his inclinations and evil tendencies to his offspring, and he gives them disease from his own inflamed, corrupted blood. Now, how does that happen? It's interesting. When there is you can read about this, when there is an intake of too much food in the body, okay? Or too many varieties or kinds of food at a meal, right? What are we told happens to all that food in the tummy? What's developing there? Fermentation, okay? And in any oxidative breakdown of your foods, your carbohydrates, what is going to be formed as a result of fermentation? Alcohol, okay? And what did we learn about alcohol? It is pro-inflammatory, okay? So you can see the connection here by the intemperate man who is eating foods, too many, not the right kind, and overeating, what this results in. And this can cause inflammation. And then there are things that can also irritate. Your irritating condiments such as mustards, pepper, spices, pickles, makes the blood feverish and impure. So it is going to be one of these pro-inflammatory things. And we talked about how caffeine can do the same thing in the sense of constricting the blood vessels, causing intense vasodilation, and because of the brain stimulation, the autonomic nervous system, the sympathetic nervous system is stimulated, and you get all of this outpouring of the stress-type hormones. So we can see that there are reasons why people are getting some of these diseases, right? And all we're trying to do is help them to understand, so if they want to, they can make better choices in their life, and we want to encourage that. Conventional drug therapy for coronary artery disease and hypertension, I don't think we have to go on that. There are all kinds of agents now that are there from the traditional medications that we can use if we need to for a time. Surgical options for coronary artery disease where a blood vessel is constricted. We can actually do what is called coronary artery bypass grafting, where we take either an internal mammary artery or we can take the veins out of the legs and we can bridge across that area of obstruction so flow can bypass that. We call that a coronary artery bypass graft. Or we can do what is called balloon angioplasty, where we put a catheter through either the groin or the brachial artery. We thread it back the aorta to the opening of those coronary vessels. We can enter them, and once we enter them, we can see where the obstruction is, and then we can slide a little catheter sleeve over that into that area that has, you can blow it up, and then it balloons that area up and tries to, fracture that clot and open up the vessel. There is a risk there because you can also rupture vessels that way. So the heart team is usually on standby all the time when we're doing these. And you can also then next, once you dilate it up, you can actually put in a metal stent, which is now, it's a wire cage that's keeping that vessel open, not allowing it to close back. Only problem with that is you usually then have to keep the patient on anticoagulant medication or antiplatelet medication for a period of time afterwards. And if we want to use some of the botanical medicines, I've listed some. They're probably small and you can't, but let me just mention this. There are agents that can be used to control hypertension and diminished coronary artery blood flow. A good agent for the coronary arteries as a vasodilator is hawthornberry. Hawthornberry improves oxygenation of the heart. It dilates up the coronary vessels. It's a very nice agent to use, typically benign, no problems with it. And then there are agents for the hypertension such as motherwort. I'm just mentioning these. Coleus, we use a lot of Coleus forskolin. How many here have seen the plant that you like to put out? It's just pretty. Coleus? Okay, it's in that genus, or yeah. It does the same thing. It dilates up the vasculature. So we use it in hypertension. Cramp bark, if you've ever heard of that, we use it to control muscle cramps, but it also relaxes smooth muscle in the vessel wall, in the bronchial wall, so people that are suffering with asthma, airway disease, people who have hypertension, we can use cramp bark to try to open that vascular system up. CoQ10 is used, valerian, passion flower, and so forth. For high cholesterol, we've got red yeast rice, we've got artichoke extract, we have gugulipid. I mean, there are a lot of things that we can use now as well, so we may not have to feel so dependent upon all of these drug medications, and have shown good response in the medical literature. So this is just a few of these. Garlic also, if you like to have garlic with your meals, is an excellent agent to lower blood sugar, to lower blood pressure, blood cholesterol, and so forth. So, and then if we want to prevent it, simple little things: plant-based diet, outdoor exercise, maintain ideal weight, proper rest, stress management, temperance in all things, trusting in God. Have we heard those anywhere this weekend? It's not complicated, right? And it doesn't mean that if we do all this that we're immune from disease, does it? You hear that, well, I know so and they've lived a healthy life, and they've been outdoors, they're gardening, and I've got a gentleman right now that I'm following down in South, and he's done all those things, and he has coronary artery disease. He's had a couple of stents. How do you explain it? I can't tell you. I don't know. But all I know is what God has written. And if he's written it, then it's safe to follow. And in those exceptions to the rule, then what do? Try to help those people, right? Do whatever we can to help them in every way, and let them examine their own lives and see if they're really doing everything that they know to do. And another big factor we haven't even put here for all diseases is stress, right? it's terrible because it just activates the sympathetic nervous system, which does everything. It's good for a moment of fight or flight, but if you're living your days in fight or flight mechanism, that's not good. And that's what stress does to us, right? And that's why God says, bring it to me. Don't carry all that stuff. I don't want you fearful and burdened with all these things. Give these to me. So we just help where we can. And I think Job probably had a few problems too, didn't he? I believe I read somewhere where God considered that man a righteous man. And yet, did he get sick? He got sick, didn't he? To the point that he desired death rather than life. And yet, I tell people, okay, if you're having a Job experience, okay, and you've examined and everything that you know of that you're doing is in harmony with the Lord, and you're still going through a Job experience, then what would you do? Hold on like Job. Because your latter end is going to be better than your former, right? That's what God says. Endure to the end, and those that endure to the end not only now will be saved, but they are going to have that promised gift that many of our forefathers died waiting for, the promise to be granted to God's people. So that's what we want. We want to be faithful in all things, and if we are attacked by the enemy, just ask for the Lord's help, and He will be there to help us. Okay, any questions about coronary artery disease? Yes, sir. Probably both. Probably both. I think that's a very good observation, because we can't deny that there is genetic transmittal of disease, transmittance of disease. But at the same time, we can also either fuel that or mitigate against it by our lifestyle. So if we both inherited problems and we're also living like our forefathers and we're not changing that, then we are destined to repeat their same history, for sure. Okay, but we try to do the changing there. Okay, we can't change our genetics, so to speak, but we can certainly modify our lifestyle. Weaker and weaker. Yeah, that's true. Yes, sir. Forces. Okay, we have a few, another drawing. And then we're going to have the last presentation. And Donna Anthus is going to talk about stress and what? Relationships. You mean there's stress in relationships?